Okay, so let's discuss Bryan Johnson's Blueprint program. We'll discuss Daniel Ek, who's Spotify's founder, launching his own health biz, and then VitaDAO raising $4 million, including from the likes of Pfizer and Balaji Srinivasan. So do you want to start with the Bryan Johnson story?
Yeah, he's an interesting guy, right? Bryan Johnson's Blueprint program. So this guy is this multimillionaire who is spending $2 million a year, apparently, to live forever. Now, as a longevity doctor, I've been in this space for a long time. I actually have a backdoor view into his protocol. I've been following his protocol for a few years, just because the main physician, the main doctor that is designing his protocol is actually a friend and collaborator of mine. He's based here in Cambridge. And he's been sharing his protocol with me as it evolved over the last few years. So I have a bit of a backdoor view into this. But for those who don't know, let's kind of summarize the story. So Bryan Johnson is a multimillionaire. He's the founder of Braintree. Is he a billionaire? Maybe. He exited to PayPal. He's the founder of Kernel, which is another cool company. So his premise is that, what if I take my emotions out of my health altogether and just follow what the data says when it comes to his general health and well-being? He wants to live as long as possible. And the way he's doing that, he's gathering as much data as possible about his body. This includes metrics that quantify the function and biological age of every single organ in his body. And we have more than 80 organs in the body. So the idea is to quantify every single organ's age and then try to optimize that age. So he has a team of researchers researching how to optimize these metrics and make them similar to an 18-year-old. In many cases, he has his 17 or 18-year-old son as a comparison. So he's trying to reverse his metrics to be similar to his 18-year-old. And he's achieved that in a few metrics, which is interesting. But what this ultimately has led to is that he follows a very strict diet, and he actually does calorie restriction. Calorie restriction is probably one of the interventions that has showed the biggest impact on health, on longevity in mice and also in primates. Some interesting human data. So he follows a very strict calorie restriction diet, and what that means is he goes, I think, 20% under the recommended daily requirements from medical guidelines. So he goes like 20% under, which is quite interesting. But what he does is he measures his metrics and bloods regularly to make sure that he's not malnourished. Other than diet, obviously he does a lot of exercises and focusing on different verticals of health. He does more than 100 supplements every day, and he does all of these all kinds of different interventions to improve his health.
So wait, I don't know what to make of this. I think he's clearly an excellent marketer. I've watched a lot of his videos. Seems super smart, super driven. I like his mission. But from your perspective, what's kind of BS in all of this? What's legit? Like, what's the 99%? What's the Pareto principle stuff? Because 100 supplements sounds pretty crazy.
Pretty intense. I mean, he basically says that this is an experiment, right? And he's aware that a lot of this is just experimentation. I like the idea that he's taking kind of his emotions out of it and just following what the data says. His team, which I know and I've worked with and I continue to work with on different projects, is very much evidence-based. So they understand the value of following evidence-based medicine. But the thing is, evidence-based medicine can also apply to N=1 experiment. So if you're doing an experiment on yourself, and you're shown improvement in metrics following a certain regime, then that's also interesting evidence. I think in his marketing, he does rely too much on epigenetic age clocks, and like the rate of age, he calls it, and he claims to have the world record in reduction in epigenetic age, which doesn't really mean anything. And I think they know that it doesn't really mean anything, but I think they use it for marketing, because that's not the only metric he measures. He measures proper functional metrics, like from everything from the standard metabolic health, heart health, even like VO2 max, all of these metrics, which are more meaningful than epigenetic age.
Wait a minute, what's an epigenetic clock, and why is it BS?
Well, it's not that it's BS. Basically, these epigenetic clocks measure the methylation pattern, which is these chemical patterns that that occur on our DNA with age, and they correlate well to chronological age. So scientists can measure your epigenetic age and kind of predict how long you have to live and what your biological age is from these tests. The problem is that we don't know if improving these metrics actually correlates to any real health outcomes that people care about. So if I lower my biological age from 40 to 30, does that actually mean anything, or am I just lowering a number? There's no evidence to show that these epigenetic clocks actually correlate to any meaningful clinical outcomes. That's why in my practice and in my protocols with people, I don't really, these are nice to haves. If people ask for them, I would look at them, but I would usually go for hard clinical and functional tests to measure biological age.
What I wonder with him is that clearly he's a really rich dude. He's living his life. Why is he publicizing this so much? Like, what's the shtick with? Because presumably he's not going to be selling an ebook on Gumtree and trying to make a few $1,000. Like, I don't really understand his motives. Maybe.
Yeah, I mean, I don't want to psychoanalyze too much, but from listening to him and following his journey, I wonder if there might be some like OCD element here. Look, I don't know, but I hope not, right? I hope that there's no psychological issues going on that are making him kind of be so meticulous about his health. And I hope this is a self-aware experiment. It seems to be that. He seems to be a bright guy, and he's just following this rigid experiment, and he's sharing the results with the world to hopefully help other people follow those that work for them. I'm all for that, but yeah, I hope there's no kind of psychological or maybe harmful psychological underpinnings.
So I think the interesting bit here from when we were talking before is you've got like a version of this regime which is maybe slightly cheaper, slightly less meticulous, but we'll probably get 99% of the results. Do you want to talk through maybe like the differences between what you might recommend to the ordinary person versus Bryan Johnson's?
I guess, look, if we imagine Bryan Johnson being like, doing everything he can possible, spending $2 million a year, having a team of, I think he said 25 to 30 people. So if that's like kind of the highest you can go, the lowest you can go is doing nothing. I think you can get 80% there just by doing the things that you already know are healthy, like not overeating, cutting out processed food, so having a good diet basically, and exercising. Those two things alone are probably will get you 80% there. A lot of what he does is skincare as well. Actually, I've started to kind of take care of my skin a bit more since then. I've actually seen an improvement, so I think that's an awful wonder. Well, no, yeah, that's an underrated element of like just helping you feel good about yourself. I think that guys don't follow. But anyway, getting 80% there is just about diet, exercise. And then if you want to go maybe the extra mile doing the regular checkups, the checkups that I do are checkups that you wouldn't really do with your like regular GP checkup. So that would include an extensive cardiac lipid panel, like an extensive metabolic panel, VO2 max, DEXA scan to look for different body composition metrics, and a few other tests. So maybe add on to that pheno age test, which is a biological age test that is based on clinical markers rather than epigenetic markers, and a few other tests that I think are kind of interesting. You could do these within a budget of a few £100 a month with doctor consultations and everything, and that would get you maybe 99% there.
Is there anything in his regime which you think is totally crazy or maybe just not very evidence-based? Is there anything that's struck out for you?
So one thing, not just about his regime, I'm not really a big advocate of doing whole body MRI scans. I think it looks cool and people feel like it's helpful, but it's probably less helpful than helpful doing whole body MRI scans to screen for cancer and stuff like that. And the evidence actually supports that. You'll probably, a lot of what people don't appreciate is the more you know, the more false positives you're going to find. We don't even know what a lot of what goes on in the body actually means. So a lot of the time we find findings that we start investigating, and that end up being maybe just normal variations. And that's the problem with these kind of extensive health checks. So you need to go into it with that in mind.
There's the really interesting, I linked it in our notes, but the Cochrane review, which is like the granddaddy of evidence. It's like the evidence that summarizes all of the available evidence. And really interestingly, I mean, relating to your point on imaging, but also relating on these kind of general health checks, it found that general health checks in people, so kind of bringing them in for a health MOT, checking basic weight, blood pressure, potentially doing a few bloods and maybe some imaging, but probably not. They don't really have any evidence to support that they reduce mortality, which is really, really surprising, I think, because you'd think that if you bring a 56-year-old off the street and you do a general MOT on them, surely you're going to find something, you're going to find some abnormal blood, maybe you could start them on some management for that and extend their life. But there's actually no evidence for that, which I thought was really, really crazy, because there's a lot of startups in the space that their whole philosophy is essentially like, like medicine is crap. It's well, like all these doctors, like they don't really care about you, or they've not got enough resources, and we're going to give you this thing and that's going to improve your health. But like, I think fundamentally it's not really evidence-based.
Okay, I get that, but I think it's more like what they measured in this study is kind of offering people tests rather than like them actually getting tests. And because we know that screening tests work, right, for certain things. We know that catching early people with high risk of heart disease early on and treating them works. But does maybe offering like a general health check to everyone every year work? Maybe not, just because a lot of people won't go through the checks.
So you think because this study was maybe too unfocused, or what's your point?
I think it's more like for a general population, if we offered everyone a general health check every year, how many of those people will actually go through the check? So I still believe in general health checks. I think the more advanced they get, the better they will be, but you go into them knowing that there's a possibility of false positives. If you're the type that wants to know more and you're fine with kind of living with that ambiguity until you know, then I support it. But for many people, it might not be the right approach.
Okay, can we move on to the Spotify story, or do you want to say anything else on this? Because it kind of relates.
Yeah. Let's talk about the Spotify story.
Okay, so Daniel Ek, who's Spotify's founder, has basically conquered music streaming. He's got through all of the crap in terms of regulation, in terms of kind of big vested interests who didn't want it to happen, and now he's moving into health. And I think this follows a big group of entrepreneurs who are now, they've kind of conquered their own industries and they're moving to health, and they don't necessarily have a health background, but I think they promise to bring that kind of disruptive thinking that they've applied to other industries to health. So super, super cool. Let me just give you a brief kind of breakdown on what he started. So it's called Nico Health. He's been working on it since 2018. They've raised north of $30 million, something like that. And essentially it offers advanced full body scanning to help doctors find and prevent disease. So the basic model is that you pay, I think, is 150 euros. They do some examinations on you by a doctor.
That's quite cheap.
It's quite cheap, isn't it? It's not a lot. They claim 50 million data points about skin, heart vessels, breast, etc., which I don't really understand. And they're apparently using some AI as well, which they haven't really gone into detail on what exactly they're doing. But long story short, it looks like a pretty reasonably priced way for people to get a general health check using imaging and other modalities. Do you have any initial thoughts on that?
Yeah, it seems like every day I hear about a different startup popping up that is tackling this problem. It's a bit of a big problem, but I think people don't understand it that well. I've been in this space for a long time, and you kind of go down the rabbit hole, and then you find that it's actually a few different problems. It's such a complex ecosystem, and it differs from country to country. But most people have this innate feeling that, look, I kind of haven't found any healthcare service that I like. No one likes healthcare service. No one likes doctors. Everyone feels like there's something missing. And then, a lot of people are trying to solve these issues. No one has actually cracked it yet. And I don't know if it can be cracked because there's so many different elements here. When we're talking about longevity services, there's a few different categories here. There's testing, and then there's kind of concierge ongoing care services, and then the specific treatments. And different people seem to be interested in different ones. So for some people, their ideal service would be, look, I just want like a prescription for this certain drug that I've heard that can, improve my health. All I want is for someone to give me this prescription and do it in a safe and effective way. Other people want like a whole body MOT, like what this place is offering. But the problem with these is most people, from a business perspective, when you start a service like this, you're targeting people who have already done probably tests and have already done a few of the tests that you're offering other places. So, for example, when I offer someone a general kind of 360 health check, they say, yeah, well, I've already done like my health check for my insurer, and I've also like bought this product, and I've also done this scan. So they've already done a lot. So in principle, it sounds good to do like a 360 health check, but most people do this anyway, and especially the people that you'd be targeting with a startup like this. And then there's the concierge medicine part, which is kind of bringing all these services together and having like kind of an ongoing relationship with the patient enabled by tech. I think no one has cracked this properly, but the problem with this also is that people who are willing to pay for this are, maybe the pool is high, but it depends on the price point. But the problem is it's a very personalized endeavor, and to do it well, you need a lot of resources, which will make the price point high. And at that price point, you're looking at a small pool of people who are willing to do that.
Okay, well, let me give some positives. Let me give a positive spin. So what I like about this idea is that you're solving rich people's problems, essentially. So it's not the great for kind of equality and other bits, but in a sense, as a business proposition, it's interesting because, hey, these are problems predominantly rich people who have time to think about this kind of stuff. Once solved, you're solving that. The second thing is, I think Paul Graham has this really interesting framework. He's the founder of Y Combinator. He says that look at what rich people are doing today and then offer that to the masses or democratize it, and that makes good business. So I think the examples given are things like Uber, that was essentially you having a private chauffeur, Deliveroo, basically you having a private chef. So basically just look at what are rich people doing right now, make that into a business that scales at 150 euros per patient, and you'll have a successful business. So I think those are the two interesting bits of this. And then the third bit already mentioned is just that he's already kind of tackled a behemoth in the music recording industry. So I have a lot of hope. And he's got a lot of clout as well, I guess. So that's another price.
No, I get that. But the thing is, like, if you're going to offer a cheap service like that, or like 150 a month, then he's probably doing what is he doing? He's probably doing blood tests that by a third party. They're not like, they probably haven't invented a new blood test, right? And I think they're probably putting a layer of AI over that to give you kind of more information over the blood test that you've already done. But actually, what you discover is that blood tests are important, but they're not as informative as you think when it comes to kind of how much you can get out of these tests. And at the end of the day, I think there is a role for someone to kind of logistically solve this problem, and that's something that I'm working on too with scaling my business. But I think at the end of the day, it comes to the kind of the hard science of like inventing new tests and new treatments that will actually move the needle when it comes to longevity.
I wanted to talk about the mental models or the kind of thinking that essentially Silicon Valley tech bro type people bring to medicine, because they are by and large essentially engineers or entrepreneurs, and they come to medicine. So I think it's super interesting how they have a completely different take on the world. And let me read you this quote from, I think it's from Daniel Ek. So he says, "Isn't it strange that since 1965, we inspect our cars every year, but we wait until our bodies fall apart before we do something about it?" And I think that's really, really interesting, because it's kind of like this reductionism of thinking that the body is kind of like an engineering problem, almost in the same way that a car, if you examine the engine and you examine the drive shaft or whatever and keep on going, eventually you'll find the problem. So I wonder, and I essentially agree with me, that thinking, is this actually a useful model to have when you're dealing with people's health? Because I suspect not.
Yeah, I see that, and I kind of adopt a similar approach. I guess that like the more you measure on a regular period, the better. But the problem is that the analogy doesn't work because the car has been designed by someone who understands everything about it. We're dealing with a human body that is like so complex, and that we don't even know the meaning of what we're measuring. That's the problem. When like at a high level, but I think the more we test, the better, in my opinion, and the more we make these tests kind of, the more we make them cheaper and accessible, the better.
Yeah, I guess. I think what kind of, I'm saying rubs me the wrong way. I'm actually really excited about this. But what I think when these types of people come into health, I think they don't clock, or what stinks is that you can tell they've never dealt with a patient before. And I think like basically the whole premise that just by scanning or just by doing blood tests, you will reveal everything about someone. Maybe it will be true one day. But I mean, just as some examples, like Parkinson's disease, there's not a test, there's not a blood test, there's not a scan that's going to tell you someone has Parkinson's. It's a clinical diagnosis. Depression, there's no scan. Bell's palsy. I mean, there's loads of conditions where there's no point putting someone. You can put them through 100 scanners. There's going to be no benefit of doing that. It's like kind of the art of medicine, which I think would surprise some of these people. I think in their view, it's like, fuck it, we'll make an MRI scanner that's even more advanced, and then we'll solve that issue as well. Or we'll make a phone that uses the accelerometer somehow to detect this before it happens. But I don't think that really works.
Yeah, and like to add to that complexity, there's the whole emotional and psychiatric or psychological aspect of health that is so difficult to quantify and deal with. So like a large amount of people with pain, for example, have a big component of that is psychological. And this is where kind of pseudo medicine and kind of snake oil salesmen thrive. A good example of this is PRP and stem cell therapy injections, for example. These are like super expensive injections that people take because they have like back pain or knee pain or whatever. And there's loads of anecdotal evidence out there that when people take these injections, they actually improve. But it's mostly placebo, and people don't understand how big the psychological element of these issues are, and how how much of an impact it can have on people.
Absolutely. Have you got anything else to say, or do you want to move on to the VitaDAO story?
Yeah, that's super cool.
Okay, so VitaDAO is like if longevity, crypto, and open science had a baby. So a DAO is a decentralized autonomous organization. It's being popularized recently in the whole kind of crypto boom and bust now. But essentially, I think an easy way to think of a DAO is it's like a WhatsApp group. It's like me, you, and a few other people got together. We have a WhatsApp group, and then we have a bank account attached to it. And we start making some decisions, and that can be on funding, that can be on lots of different things. So VitaDAO is this group of people who are focusing on longevity research, and in particular, they're focusing on this kind of death valley of research where big kind of academic institutions and grant and funders and things aren't interested, and pharma aren't interested either. So it's the kind of high-risk, early-stage longevity research. So basically,
I would say it's high risk early stage. It's more like I don't know if they're doing this, but I think a good example of this is rapamycin. So rapamycin is an off-patent drug that is cheapish, and it's off-patent, so it's not owned by any one pharma company, and it might have longevity benefits. But the problem is no one is willing to fund a study in humans to measure the effects of rapamycin on longevity, because no one's going to benefit from that. And that's where I think something like VitaDAO would be of help, because pharma companies aren't going to fund that, and it's difficult to get governmental organizations to fund anti-aging research anyway.
Yeah, absolutely. I don't know if they're funding anything in rapamycin, but that's exactly the kind of thing they could do. Let me just give you the reason why a DAO in this space is better than traditional things that already exist, because we've already had examples of lots of patient groups getting together. For example, patients with a really rare disease that only affects 500 people in the world. Grant funders aren't interested, neither are pharma, there's no business in it. So they just get together, they put some money together, and they fund some research into it. So that already exists. So why is this different? Well, one of the problems is that you don't really get any stake in the upside or the ownership of the project. So what's interesting about VitaDAO and other projects like this is this concept of IP NFTs. Do you know about this?
No.
So an IP NFT is like intellectual property, right? And then NFTs, I don't think anyone truly understands what an NFT is, but it's like a token essentially. So let's just say an IP token. So it's a token or a coin or something that represents some intellectual property. What's really interesting about VitaDAO, and I think they're currently working, I spoke to Nicholas Rintoff a while ago, but they're working on the kind of legality and how to make this happen. But in theory, once this DAO funds a project in longevity, if that goes on to be commercialized or picked up and made into a blockbuster drug of some sorts, they would have some ownership of it. So the people not only would have made that decision, put their money together, but they'd actually have ownership in the end product, which wasn't the case before. So I think that's really, really interesting part of this whole story.
So wait, I would have ownership in what?
So traditionally, right, so like a funder will take, say, taxpayers' money and they'll fund a project and it'll fund loads of basic science and then pharma will take that and make a blockbuster drug. And you're not getting any kickback from that. You would essentially, in theory, get some of the upside, as in you would own the IP that then pharma would presumably have to license or buy off you.
But I thought the whole point is to fund things that won't produce that kind of commercial IP because that's covered by pharma companies.
Not necessarily. I think it's to fund things that they're currently not interested in for whatever reason, but potentially one day could. I do agree with you. I don't think these VitaDAO and other DAOs really have... I think they're more of a mission-driven focus. They're not necessarily... It's not about getting rich like an investment. But I think there still is this interesting mechanism of IP NFTs where at least you get some of the upside. So maybe you can then use that to fund more research, or you can use that to give the initial people some of the kickback. It's pretty cool.
Yeah, no, I like the idea of like funding things that are kind of unfundable, but doing the whole like putting the whole spin on it that like you can get part of the upside just doesn't make sense, because if there's any alpha there in any project, there's already someone who is willing to take the risk and fund it. In my opinion, I don't know. Maybe I just didn't get it. Maybe I'm just a bit too dumb to understand that.
No. Well, that's not the case. But I think there are some projects like maybe even like early stage investment, right, where it's like it's.
What about a rapamycin DAO? How about that? I think this would work. I swear to God, like a rapa DAO.
Rapa DAO.
We could probably get like fund like a rapamycin study.
There's a few others in this space as well. There's one called VitaDAO, which is focusing on women's health research and issues, because that's historically been something that's not had a lot of focus. And there's this group of people who feel that, and they're kind of putting their money where their mouth is. There's also one, I forget its name, but it's based on rare disease research, which is a super interesting problem because there's over 8,000 rare diseases and, affecting 100 to thousands of people, and they just don't get funding. So it's very, very cool. I think one thing I wanted to just talk about was the kind of mechanism behind this, because there's this thing, have you heard of this like wisdom of the crowds, where it's like if you take a group of people, their collective intelligence is greater than you would expect, essentially.
Yeah.
There's also tyranny of the masses, where if you kind of democratize this whole process and you let groups of people on WhatsApp decide where funding is going, are they just going to make really crap decisions? To get around this, they pre-vet the projects. So they get like a panel of basically smart people who go through every project that's submitted and just make sure it's legit, it's not snake oil, it's not BS, they're doing what they're saying they're doing. And then they present that to the group, the wider group, who then make the voting decisions. So I think it's very interesting, and maybe it will result in something crazy coming out.
Yeah, that's really interesting. As I said, I think they should focus on things like rapamycin, which, off-patent compounds that are successful in mice, but we need human data. So I think that would be a good place to start.
Yeah, man. Well, join the group and put some money in, and you can vote.
I can vote, right? Yeah. I doubt I can contribute as much as Balaji. So.
Yeah, and that was the last interesting bit, that Balaji Srinivasan, CTO of Coinbase and just OG, and even Pfizer has put money into this. So it's kind of an interesting mix of like, I don't know, Pfizer, like old school pharma coming in. I've heard this framework that basically pharma let small biotech startups and even things like these VitaDAO and other bits, they just let them, it's kind of like a playground. They just let them do interesting shit. And then as soon as they start looking like they're going to be successful, they just buy them up. So I wonder what pharma or how they'll respond to this if something actually comes out of it.
That makes sense.
Yeah. Anything else, or should we call it a day?
I think we've covered quite a lot. Let's wrap it up, and until next time.
Until next time, man. Okay, this was fun. All right, I'll stop recording.